is not playing ball. So
that's a-okay. That is completely understandable. So next up we have Paige Bromley, who is, if I can flip the page nicely, a first-year PhD student at the University of Winchester in the Criminology Department. Her research explores the impacts that the COVID-19 pandemic has had on rural domestic abuse services in England. And she will be sharing her poster today on Rurality and Domestic Abuse, a review of the literature. It's all yours. I say that and I think, there we go. I was going to say, I think her internet cut out because she disappeared. So we'll give her a second to come back. This gives Amy and I some good editing experience. So Paige, are you back?
Yeah, I think so. I maximized the screen and then it just said your device settings and it told me that my headphones had stopped working. So I had to leave and then come back. But I'm assuming you can hear me.
Yes, I can hear you perfectly.
Okay, good. Sorry about that. There's always a
That's okay. That's okay. Go ahead whenever you're ready.
Great. So yes, today I'm going to be talking to you about my literature review for my thesis. And my PhD is broadly looking at rurality, domestic abuse, services, and COVID. The thing I want to be presenting today is looking at how rurality impacts domestic abuse. So to start with, I just want to talk about kind of the concept of rurality and how it's kind of very difficult to define and conceptualize what rurality is. And there is debate amongst different scholars about how that can be done and if it can even be done. Woods 2011 says that rural is an elusive concept, a term that does not describe a hard, fast, and indisputable material object, but rather refers to a loose set of ideas and associations that have developed over time and which are debated and contested. So basically what he's saying is there isn't one rural, and I put that in air quotes but you can't see me, and we can't just kind of use this blanket term rural to describe and talk about anything that isn't a town or a city, because there is difference between rural areas. There's sometimes more difference between rural areas than between rural and urban areas, sorry, within rural areas than between rural and urban areas. However, whilst rural areas are heterogeneous and variegated, when it comes to the experience of survivors of domestic abuse, there is some consensus across the literature that there are common features of living in a rural area that can, impact and complicate the experience of domestic abuse. So that's kind of what I'm going to be talking about today. And they are broadly victims, survivors experience more severe and frequent domestic abuse when they live in a rural area compared to when they live in an urban area. The impact of geographic and social isolation, the lack of service provision and the time it takes either to travel to a support service or for a support worker to travel to you, and kind of the difficulties in doing that when you live in a small, close-knit community, as often they are when you're in a rural area, and also patriarchal and class power relations and how that impacts as well. So to start then, risk factors. So victim survivors that live in rural areas are likely to experience more severe and more frequent rates of domestic abuse than those living in towns and cities, and that's something that is broadly agreed on within the literature. Different types of studies tend to come to the same kind of findings around this. And they also tend to find that geographic and social isolation are really big factors. So obviously if you live in, a countryside village, or, if you live on a farm, often that is complicated by the lack of public transport or the lack of access to cars, and the distance that must be travelled to get to your nearest support service or your support worker coming to see you. You know, if there's one bus into the main town where the support service is located, one bus every hour, and you miss that bus. And obviously there are obstacles that come with that when you're being kind of abused by someone as well. It's not just easy to just nip out. And that can be, you know, kind of exacerbated by social isolation. So one of the tactics of perpetrators is to socially isolate their victims, which is a lot easier to do when you're in a geographically isolated area. So, you know, not allowing them to drop the kids off at school, moving them further and further away, you know, moving to a farm and saying, well, you have farm work to do, you can't go out and like speak to your friends, things like that. Rural communities are often close knit with everyone knowing everyone's business, and that can make it easy for perpetrators to surveil their victims. So they can ask the neighbours if a strange car pulled up on the driveway. They can ask, they can easily slip into the conversation with, you know, the doctor about, oh, did my wife come and see you today? You know, what was she talking about? It's very easy to do that when everyone is friendly, everyone knows each other, and everyone kind of knows everyone's business. And that makes it hard for victims to kind of reach out and get support, whether that be from a support service. I mentioned the doctor, I mentioned the police, I think, before. So that can be very difficult. However, there is contradiction over the levels of help seeking within rural communities. So some people say that help seeking is kind of negatively impacted by this kind of close-knit nature. You know, people don't want to, they don't want to say that these things happen in rural towns and cities. So therefore, when people speak out, it can be very difficult. Other people say that the close-knit nature means that neighbours are more likely to help their neighbours. So there is a debate there. However, what isn't clear and what isn't really addressed in the literature is how bad things get for survivors before they're able to reach out for help. So the fact that they are cited as experiencing more severe and more frequent rates of abuse, is that because things have to get so bad before they're able to reach out for support because of all these other factors that I've just mentioned. So moving on then from kind of expanding on this idea of the close-knit nature of rural communities, that's closely linked to gender and class power relations, which can serve to obscure the recognition of violence. And as I said before, what basically that means is people who like live in rural communities and they know everyone, and you know, they know the perpetrators, they kind of don't believe when people come forward with stories of abuse or accusations of abuse, or and it can be very hard to be believed and to get the support that you need. Some researchers argue that there is a specific rural patriarchy, which is also called the Old Boys Network. It's also called male peer support network, or a new form of patriarchy. And basically what these scholars are arguing is that patriarchy and the way it manifests itself is very specific to rural areas. However, I think it's important to not other gendered power relations in rural areas. We don't want to see it as something different and something separate and something, you know, strange or weird that only happens in those places. We want to still see it within the context of global patriarchy. And someone mentioned the continuum of violence earlier, and I think that kind of mentality and framework is still really important, even though we're looking at like a specific geographical area. Changes to traditional industrial and family structures can increase the risk of domestic abuse and lead to high levels of poverty within the community. So kind of the decline of farming and the traditional male breadwinner family setup is changing. Women are having to go out to work. Men aren't able to kind of make their money from like simply just farming. They're having to like change and expand. And kind of that loss of like power is argued as having an impact, and kind of men trying to regain their position and regain their power within the family kind of leads to increased risk of domestic abuse. It's argued by some researchers. And rural women can have fewer economic resources, which can make it harder to leave their abuser. So if they have been isolated from their friends, their family, they've not been allowed to get a job, they live really far away from, the town, the nearest big town, they don't have anything. They don't have anything in the bank that they can just kind of draw on to be able to leave. And it makes it harder when the distance to travel to get somewhere safe, you have to pay for a taxi, you have to pay, for a bus that goes really far. It can be very difficult. So thinking about service provision, then I've mentioned kind of a couple of difficulties with service provision already. And the lack of coordinated community response between different services is cited in the literature as one of the biggest challenges that services face. And that can be because rural areas are underserved by services. So that can be specialist services, domestic abuse services, even perpetrator programs, but also generic services. So like the GP, hospitals, things like that. And it isn't necessarily that there isn't those services around. It's just the way the resources allocated is based on need a lot of the time. And it's kind of assumed that people in rural communities don't need those services because rural communities are safe and happy and friendly, and violence doesn't happen there. As I mentioned already, survivors have to travel often long distances to access specialist support. And that can be complicated by, as I said before, lack of access to cars, lack of available public transport. Support workers aren't always able to come into the village, for example, because everyone will spot the car and they'll know that there's a strange person kind of in the area, and then the perpetrator will find out. So there's a lot of hoops, I guess, that have to be kind of jumped through to get the support that survivors need. And there's also a lack of awareness, or it's argued that there's a lack of awareness amongst professionals of the nuances of living in a rural community. So you have to kind of have an understanding of the way that rural communities work, and why it's more difficult to reach out for help, or why it's not as easy to just call the police because the police officer and your husband drink in the pub together every Friday and you would never be believed. Which kind of brings me on to my next point now about perpetrators are often well known to the local communities. They're often friendly, they're thought of very highly, and it can be very hard to report those people to the police for fear of not being believed. So future research then, there are several limitations that I kind of identified whilst doing my literature review that warrant further exploration, or you need a bit more research kind of focus on these areas. So pretty much every study that I've looked at so far for my literature review, which is a lot, as I'm sure you'll all appreciate, look at male perpetrated abuse against female victims in heterosexual relationships, and kind of like middle age as well. So there's very little focus on LGBTQ plus couples, or older couples, or even family violence dynamics where the adult children might be the perpetrators of abuse, or young people, and race, ethnicity, immigration status is, it's not considered hardly at all. And obviously all those things have impacts on how someone might be being abused, but also how they might struggle to access help because of all these different things that might be happening for them. Much of the literature is focused on the United States, Australia, and Canada, and that's pretty much all of the literature that I've read. So there's a significant gap in the literature on the impact of victim survivors who live in rural areas in the UK, which is where my thesis is based. I'm going to be doing research in the UK to hopefully try and bridge that gap, because, as I said before, the countryside is a very broad term, and rural America or rural Australia is not necessarily going to be the same as a market town in England. So we can't, whilst this information is all very helpful context, we can't just generalize across places. And we need to make sure we're doing research in lots of different places to understand the experience there. More explanation of the link between risk and help seeking is needed. So I mentioned this before, And people do talk about survivors' abilities to reach out for help, but they don't kind of talk about the risk, how the risk and help seeking kind of interact, and how bad things must be for someone to reach out for help because of all these other complications that are going on. And then probably most relevantly for kind of this forum, and to kind of open it out to anyone who might have any thoughts on this, there is debate around how gender and masculinity is theorized. So I mentioned that some people argue that there's a very specific rural masculinity, a rural patriarchy, whereas some say that that's wrong and we should be looking at kind of the global context and not othering certain communities. So that's one of the things that I'm kind of working through at the moment. So there's a lot of expertise in the room. If anyone has any thoughts when we come to the questions, obviously no pressure if not. But yeah, that's me. Thank you so much for listening.
Wonderful. Thank you so much for such an interesting literature